You screen for social needs, and what we're doing is measuring the likelihood that someone has risk and the risk that someone would have a need. Screening is, you are directly asking a person to self-report that they have a need of some kind. That requires a couple things, right? It requires that the person pick up the phone, answer your questions, be engaged with you as an individual. A lot of providers are screening in the doctor's office. Well, there are a lot of people that aren't getting to the doctor's office, so they're not getting screened. So, screening is incredibly important and a really sort of a first line of defense. But there are so many people that are not getting screened. And if you're going to build a larger strategy around how do I actually, at a population level, drive healthcare improvement and drive down costs in a meaningful way, you have to think at a population level. We've got value-based care and population health. How do you manage healthcare risk if you don't understand the risk that people face in their day-to-day lives? And so I think of them as ands, not ors. You need both. If someone is at the doctor's office and they are struggling to feed their family or they are about to get evicted and they need support services, I hope we're asking the questions to find out that that's happening for that person so that we can connect them with the help that they need in that moment. But if you're trying to build programs and you're trying to, at a population level, decide, well, what does my population need? Should we be connecting people with resources in a proactive way? You need that population level data and you need to be able to measure the likelihood that someone has that need before you reach them. And so I think, again, it's an and, not an or. They're both really important. I think of one as, higher level, more strategic, helps you sort of get ahead of a problem. And the other is a diagnosis, right? We have diagnosed that you have a need. And so let's get you the cure for that need.